What are jowls and how can we make them better, right? I'm Dr. Cohen with the Cohen Clinic, and in this video, I want to go over what is that fullness that we see here along the jawline as we start to get more mature. So the most common type of jowl is one of older age. The reason we get it is a couple things. As with the rest of our face, we are getting looser and descending with time. Things are being pulled down with gravity. So this part of the face here, this is called the mobile smas, the part of the face that you can pick up and pinch and move around. This part gets loose and comes down, but there is a very key ligament that lives right here. It's called the mandibular ligament, and it holds the skin all the way down to the bone. It's like a little elf in there with a tight rope, and he's holding that skin all the way down to the bone. This part cannot come down. You can't pull this away from the bone. So you have this part that's really loose. It starts to descend with gravity. It starts to roll around this point, which cannot be released. So that is rejuvenated and reversed and improved with a couple different ways. The face should be appropriately repositioned in the proper, primarily vertical vector, and also often the mandibular ligament can be reduced so that the skin can be repositioned more naturally to have a much better contour here along the jawline. Sometimes in some patients, we need to add a little volume here above the mandibular ligament to restore a natural contour here as well. The other thing that's often confused as jowls is fullness higher up. So you can get fullness up here, which can come from two reasons. One and more common is buccal fat fullness, and this procedure has become super popular right now with all these celebrities and famous people talking about it. It is addressing fullness in this part of the cheek. So if you're a little full here, buccal fat may be an option. The other thing that can cause fullness up here is hyperactivity or an overactive muscle that lives right here along the jawline and attaches to the corner of the mouth. This muscle can pull down or be super strong, basically, and it causes a constriction point here, which can create some fullness just to the side of it. That, believe it or not, we just address with a neurotoxin like Botox or Dysport. So these are different things that we can look at and try to figure out what is the jowl in your particular face and how do we make it better. Follow along. I appreciate you watching.